Hello, I'm Dr. Robert H. Levitt. I'm an interventional cardiologist at Enrico Doctors Hospital in Richmond, Virginia. When someone has a bad aortic valve, it doesn't open well enough and they just can't get the blood out to the body. Patients will have symptoms. It could be shortness of breath, chest pain, lightheadedness, feeling like you're going to pass out. They're evaluated by their doctor with testing, including a sound wave test of the heart called an echocardiogram. And if they're shown that this is a problem with the valve, then the treatment for that is to replace the valve. Traditionally, this was done with surgery, where it was a major operation in the operating room. They had to open up the chest, open up the heart, take out the old valve, and replace it with a new valve to be sewn in. And although it's a very good procedure and helps a lot of patients, it is very invasive and there's a lot of recovery associated with it. TAVR stands for transcatheter aortic valve replacement, and it's a way of replacing the aortic valve in someone's heart without surgery. There's no incisions or cutting in the chest. It's all done through a needle hole in the leg. The valve goes up through the blood vessel to the heart, and then the valve can be placed by X-ray guidance into a position in the heart where the aortic valve is. After the procedure, all the tubes come out. With a morning procedure, they can be up having lunch. A lot of this is done without anesthesia and with just sedation. Patients tolerate it well, and many of the patients are able to go home the next day. We've been doing it at Enrico Doctors Hospital for the past 3 or so years, and we're very excited that the program's gone well. Our results are some of the best in the nation. The procedure started out for patients that were too sick for surgery, that they were too high risk, and we got beautiful results in helping people with an aortic valve problem where the aortic valve doesn't open well enough. It then got approved for patients that could have surgery, that a cardiac surgeon felt could get through surgery, but at a higher risk of surgery, more risk of complications, more risk of prolonged hospitalization. And we're able to do this much more simpler procedure, much easier tolerated for the patient. And we put in a tissue surgical valve, the same type of valve that goes in with open surgery. Just goes in through a different method, through a catheter. And we're excited to be able to bring such good technology, not just to the high-risk patients, but to any patient with a bad aortic valve that needs replacement. The results have been superb. Our patients have done very, very well. Many go home the next day. They're back to their activities in several days, feeling better than they have in years. Very excited to be able to offer it now, not just to patients that are high risk for surgery, but to any patient who has an aortic valve problem and needs to have it replaced.